Hello everyone, and welcome to Miraculous Private Caregivers. Today, we're diving into a home care topic that we get a lot of questions about. Hydrogen peroxide foot soaks. We'll explore what they're used for, the potential benefits, and most importantly, what caregivers need to know to ensure safety and provide the best possible care. So, let's get started. First things first, what exactly is a hydrogen peroxide foot soak? It is a simple process that involves soaking the feet in a basin of warm water mixed with a small, diluted amount of hydrogen peroxide. You'll typically find 3% hydrogen peroxide solution at your local pharmacy, and that's the one we're talking about. This practice is often used for general foot hygiene and comfort, especially for clients who are on their feet a lot, wear shoes for long periods, or are concerned about things like foot odor or minor skin issues. It's a straightforward way to help feet feel clean and refreshed. But as with any home care practice, understanding how to do it correctly is key. Now, let's talk about the potential benefits. When used properly and safely, a diluted hydrogen peroxide foot soak can offer a few advantages. One of the most common reasons people use it is to help reduce foot odor. Hydrogen peroxide works by breaking down the bacteria on the skin that can cause unpleasant smells, leaving the feet feeling much fresher. It also provides a good cleansing action, helping to wash away surface germs and dirt that accumulate throughout the day. Another benefit is that it can soften rough skin, calluses, and thick toenails. This makes subsequent foot care, like trimming nails or filing rough spots, much easier and more comfortable for the client. For some minor fungal concerns, like a mild case of athlete's foot, a healthcare provider might suggest a foot soak as part of a larger treatment plan. It's important to remember that this should only be done with a doctor's approval. Beyond these specific uses, the simple act of soaking one's feet in warm water can be incredibly relaxing and soothing. For many clients, this calming ritual is a benefit in itself, promoting a sense of well-being and comfort at the end of the day. As caregivers, our number one priority is always safety. So, let's go over the critical safety guidelines for hydrogen peroxide foot soaks. This is non-negotiable. First and foremost, hydrogen peroxide must always be done. Never, ever use it at full strength directly on the skin, as it can cause significant irritation, burns, or skin damage. A common dilution ratio is about 1 to 2 cups of 3% hydrogen peroxide mixed into a gallon of warm water. The soak itself should also be kept short. A duration of 10 to 15 minutes is typically sufficient. Soaking for too long can dry out the skin and lead to irritation. A very important point: avoid using these soaks on any open wounds, cuts, severe cracks in the skin, or diabetic foot ulcers. The solution can be too harsh for compromised skin and may delay healing or cause further complications. For clients with specific health conditions like diabetes, neuropathy, poor circulation, or very sensitive skin, you must get medical approval before even considering a foot soak. These conditions can affect sensation and healing, making the feet much more vulnerable. If at any point during or after the soak, the client experiences redness, stinging, itching, or any discomfort, stop immediately and rinse the feet with clean water. Always listen to the client and observe their skin closely. So, what is the caregiver's role in all of this? It's crucial to understand the boundaries of your practice. Caregivers should never diagnose conditions or recommend treatments, including foot soaks. Your role is to support, assist, and observe within the established care plan. Always follow the specific instructions laid out in the client's care plan. If a foot soak has been approved by their doctor or podiatrist, your job is to assist with the process safely, following the exact dilution and time instructions provided. While assisting, be observant. Look for any changes in the skin on the feet and lower legs before, during, and after the soak. Note any redness, swelling, new sores, or changes in color, and report these observations to your supervising nurse or the client's family immediately. You can also promote general foot hygiene by encouraging clients to keep their feet clean and dry, wear clean socks, and stay hydrated, as overall health impacts foot health. When in doubt about anything related to foot care, the rule is simple: always consult with a client's nurse, physician, or podiatrist. It's better to ask a question than to risk a complication. Your diligence protects both the client and yourself. At Miraculous Private Caregivers, our mission is to empower you to provide care that upholds comfort, dignity, and safety in everything you do. Simple practices like a properly administered foot soak can truly make a meaningful difference in a client's day-to-day comfort and quality of life. It's these small, thoughtful acts of care, when performed correctly and safely, that build trust and show how much you value your client's well-being. We hope this information has been helpful for you. Thank you for watching. And more importantly, thank you for the incredible and compassionate care you provide every single day. We'll see you in the next video.